Episode 14. Clip 3. Big Food Lies Intentionally Misleading Federal Nutrition Guidelines and Corrupt Medical Journals. Oh my.
This topic has to do with something that I love talking about. It has to do with health and wellness and basically how to not be sick. And interestingly, Jordan Peterson,
Of course.
Canadian psychologist who's became very well known for some of his positions regarding some of the woke things that were going on. And he calls it the way it is. And he's talking about a topic we covered before with some humor, and that has to do with our food system and the food pyramid. Let's listen what he has to say.
Never recovered from finding out that the food pyramid was a scam.
Yeah.
That was just the degree to which that's a scam is, I don't know, is there a worse medical crime in history than that?
No.
No?
Telling Americans to load up on 7 to 11 servings of grains every single day.
Yeah. To find out that was a marketing ploy by the Department of Agriculture and that they went against the advice even of their own consultants who warned them that they would produce an epidemic of obesity and diabetes, which is, and not to say nothing of depression and dementia, which is exactly what we have now.
Exactly.
I don't know what you even do when you find out that's true.
And the unwarranted demonization of natural fat-containing foods, nutrient-dense foods like animal-source foods, which continue to be demonized.
Well, even by the American Diabetic, is it Association Society? I don't remember
the
which
ADA,
one
yes.
is still pushing the notion that diabetics can eat carbohydrates. I don't think that's a very good idea since they're converted to sugar.
That's the crux of all this. And if you notice, there's a theme throughout this episode. This has to do with all the behind the scenes things with governments, whether it's a government in the Ukraine or Russia, or are they really working in the interest of the people? That's really the question. And it's a tremendous scam. Most doctors, in fact, one of the things that Bobby Jr., so RFK Jr. mentioned this past week was that he's considering making it a requirement that medical schools start teaching nutrition. And if they don't, perhaps a year from now, they will stop receiving federal funding, because
That would be phenomenal.
it needs to happen, because doctors are, first of all, not qualified to discuss nutrition. They don't have any training whatsoever. That's problem number one. Problem number two, because they don't consider that and they can't fix the root cause, then all they know is to give medication or do surgery. That's all they know. So you have to understand that any information coming from a doctor is limited and not the full potential answer to the question. They give you a piece of it, listen to what they have to say, and then inform yourself as to the other possible answers. Okay, so this sort of talk that even for diabetics, they're still saying it's perfectly fine, keep consuming carbohydrates. It's ridiculous. I visited.
No clue that carbs are basically sugar the moment your body dissolves them. And therefore it is like sugar. So if you're giving people sugar and telling people to consume sugar, and the craziest part is that the US really leads the world, and as Americans we don't even notice this, but like when the FDA comes out with their food pyramid, most health ministries in most countries basically just adopt that or copy that, right? So this has just caused poison to the entire world. This isn't just a US issue, but it rolls over to many other countries around the world as well.
So I completely agree. And that is the issue. Listen, we can't save the entire world, but we can't even save ourselves. The decisions are being made because of drug companies, because of pharmaceutical companies, because of the food industry. These large corporations have, again, as was mentioned in a prior episode, there's like anywhere between 1 and 3 lobbyists per elected official in the House and the Senate. And even if you count the number of Supreme Court and other federal judges, if you line them all up, there's 1 to 3 times as many lobbyists basically going and speaking to everybody about why they shouldn't change laws, why they should rule in a certain way, why it's important. And it's just crazy. But I went to visit a patient in a hospital over the past week, and what are they feeding the patients? It's the worst food. It's almost like a guarantee that you're going to come back as a patient again. And I looked at these different things, and one of them was like funny. Of course, they like giving all kinds of juices which are laden with sugar, but they had this cranberry juice, and the cranberry juice isn't even cranberry juice. It's tap water. It's just filtered water, which is tap water. And then it has high fructose corn syrup. Okay, probably the worst of all the sugars you could have. And then it's got a splash of cranberry juice, apple juice, and some other kind of juice, just so they can say it's a juice. but it's basically sugar
Probably
water.
natural flavorings.
Sugar water. Yeah, and if they use the word natural flavoring, stay away from it. It's not natural. Because if it were a proper flavoring, it would say the name of the thing. It would say it's got some cranberry in it. It wouldn't have to say use the word flavoring. So ultimately, that's what they're feeding the people in the hospitals. If you just think about that, they're giving sugar water to people to drink in the hospital as much as they want.
And
Okay.
to the doctors in the hospital cafes, that's what they eat too. They're
Right.
getting poisoned.
But further proof that the doctors have no understanding of nutrition. Okay. They don't understand. They're eating it and drinking it themselves. And ultimately, the broader issue is again, who's got the people's back? The reason people are sick, and traditionally in medicine, person will go to the doctor to have an issue. Oh, you're a little obese, or your sugars are a little high. The attitude from the practitioners were the person's not being compliant. They're eating too much. They're being a glutton. They're not exercising enough. The answer is go to the gym and eat less. That's what they would tell them. Cut out some of the donuts. But that didn't work because that wasn't enough of an answer. And because the doctors didn't know how to give a proper answer or weren't really empowered to focus on that and spend the time that was needed. It's much quicker just writing a prescription. Here, take this. That'll keep your sugar down. Take this to lower your cholesterol, whether or not that's the right thing to do. Okay, that's a much quicker thing. And then on to the
And
next.
ignore the 200 potential side effects that you'll probably get at least 3 of.
Right.
And then you'll need more drugs to treat those.
To understand why the pharmaceutical industry and food and all this is so important, the next clip talks about something. This is a clip that's been going around from a documentary for a long time. It's certainly a viral clip, but it disappears and then people like us might put it back on. So maybe another group of people will see that haven't seen it. But this explains why the food industry is corrupt the way it is. Okay, it's all about profit, and I have nothing against someone trying to make money. That's not the issue. But to make money at the expense of people dying and being sick, that's a problem. Okay, so let's explain in this little clip why the food industry can't be trusted to do the right things and why the food pyramid and all this other nonsense, it can't be trusted because the people that are actually lobbying for and helping construct it are these people.
In 1985, tobacco giant R.J. Reynolds bought Nabisco Foods. Tobacco pioneer Philip Morris bought General Foods and 3 years later, Kraft Foods, making them the largest food producer in North America. And leaving the business of food in the capable hands of the same corporations who helped addict us to tobacco. Using the same tactics they used to promote tobacco, food companies set about peddling the entire planet a diet of processed goods, loaded with chemicals and additives, masquerading as food. This new machine operates with specific targets in mind, like addicting consumers, without them knowing it.
And the tobacco industry, just to be clear, I mean, depending who you believe, has a typical US cigarette has anywhere from a couple of hundred to thousands of chemicals added to it. Okay. We're not talking about the type of tobacco smoked by an indigenous tribe somewhere. Much of the negatives with cigarettes wasn't even just the tobacco plants that were being smoked. It's all the stuff which apparently, including sugar, was added to cigarettes, which is just okay, no surprise, right? Because sugar's so addictive. Ultimately, that's what was happening with the tobacco industry. They did it. Addiction was the key. And addiction with food is the key. That you need to go for that bag of fill in the blanks, whatever, Doritos, Tostitos, whatever it is, and go grab those chips and grab the soda. And you need to take more and more of it. That's the bottom line, is to drive up sales. It wouldn't matter if people just had this stuff sparing. I've never seen someone going and running for a piece of broccoli. I've never seen a situation where the person has consumed way too much broccoli or too much butter. I've never seen that. It's from consuming all this other stuff that's highly processed and is designed to make you be addicted to it. And the problem is that after several generations of doing this to people, as it gets worse and worse, what happens is you now have the sickest population anywhere. And the government, for the first time ever, is trying to do something. And I think that if it wasn't for this, if it wasn't for the pushback from the Make America Healthy Again movement and RFK Jr., nothing would be happening because no one was ever willing to do anything. But just to show you the level of insane corruption, okay? What during COVID did people keep saying when there was any sense of opposition? What did people say?
Listen to the science. Listen to the science. Listen to Fauci because he is science, which is the most ridiculous statement ever.
So listen to the government.
Yeah.
If you think about, again, one of the most famous statements, and amusing yet true at the same time, was Reagan made this statement. He said, "One of the scariest words you could ever hear, and those are, 'I'm from the government and I'm here to help.'"
I'm here to help. Yeah.
Very true. So the problem with the science is that, just like statistics, or as we've discussed in the drug ads that are out there, that they're not telling the whole truth. They're using relative risk rather than absolute or real risk to give an impression that something is way better for you than it potentially could be. The same thing with the quote unquote science. The things that people are looking at to rely on to determine what the science actually says has become inherently corrupt. And here's RFK Jr. talking about essentially this huge problem where the most prestigious of medical journals, the kinds that I read when I was in training, when had clinical practice, doing the various things that I did, I went to these things to understand better. And yet, watch what he says. You can't even trust the medical journals, that they're basically bought and paid for, in large part by the pharmaceutical, and I don't think he mentions the food industry, but that's been said in the past as well, that these large corporations and mega institutions are basically being controlled by the wants and needs of the actual people who want a certain outcome to be published. So the government now is actually taking a different approach and making sure that everything is more rigorously tested to a level that could be trusted. Let's listen to what he has to say.
What we're going to do is we're going to devote probably 20% of NIH's budget to replication. Every study has to be replicated. Wow. We're going to publish the peer review for the first time. We're probably going to stop publishing in the Lancet, New England Journal of Medicine, JAMA, and those other journals because they're all corrupt. And even the heads of those journals, like Marsh Angle, who for 20 years was the head of the New England Journal of Medicine, says that we no longer are a science journal. We are a vessel for pharmaceutical propaganda.
No kidding.
Because they control the journals. They buy the preprints, and they finance you. If you want to publish in a journal, you have to pay $10,000 to get the study published. So the pharmaceutical company concocts a study that shows the outcome that they want, that statins work or that SSRIs work, and then they'll publish that. They pay to get that published.
Yeah.
And they order reprints from the journal. The reprints are it's a 5 or 6 page document that has the logo of the journal on it. They sell them for enormous profits, and then they give them to the pharmaceutical reps. The girls and the odd-looking guys who go to the doctor's office, take them out to lunch.
And I can tell you that's accurate. I've sat with patients in clinic where you see the reps coming in with the bags of the food and all the literature and everything else. So they bring food, all the doctors, and it's funny because over the course of weeks, I saw this happening on a regular basis. All you would see is, and again, when I worked directly as a clinician, of course, we would have food brought to us all the time too. And it was an opportunity for the reps to come and push whatever they were trying to get us to buy more of. But they bring you food, then they bring you printouts of literature that seem very official and very professional and very convincing. But they don't bring you the stack of the raw data and ask you to analyze it and come up with your own opinion. So so when you trust the science, maybe the science we've been trusting isn't completely unbiased or accurate.
Yeah, the science shouldn't be a hammer that the population is belunged with. It's what RFK said at the beginning there is probably the most important, which is replication, right? So many of these studies, so there's this whole issue with kind of false, you have this kind of, it's very one-sided because research that fails doesn't tend to get publicized. It's only research that succeeds. And then if all you're looking at is the successful research, even if it is objectively proved you're only seeing half the story, right? So without properly analyzing and publicizing the research that fails, then all of the research is crap, right? And of course, these journals have become extremely political over the past few years, not over the past few years, but probably for decades, to be honest. And that's a little what kind of worries me about his previous news that we just watched earlier, which is very impressive, that medical students will have to start learning about nutrition. That sounds phenomenal until you realize that a lot of nutritionists don't know much about nutrition because they tell you to use margarine and low fat is good instead of healthy fat. It's unless the school curriculum is fixed, including in nutrition, teaching doctors wrong nutrition isn't very beneficial either. But having this where the FDA basically replicates all these researches, that could be extremely valuable, because replication is basically a test to see if these publicized research are, if there's any truth to it. And yeah, that's also the importance of peer reviewed. Is that's the idea, is science isn't science until different groups all around the world can test it completely independently of each other and arrive at the same conclusion, right? So yeah, that has been an issue for kind of a back view of what it's like behind in these industries. And like we started the segment with, these tobacco industries are very closely related to the poison you industries and the medical industries. There's a phenomenal movie by David Sachs called Thank You for Smoking from a bunch of years ago. And if you haven't watched it, you definitely should. It's the behind the scenes of the marketing agencies that market all these kind of death products to us. Yeah, that it's phenomenal movement in the right direction, but we really need to see more. But this idea where the FDA will be replicating tests and publicizing them, and where the FDA will be doing peer reviews, that could be extremely beneficial. It's good for the FDA getting back to doing its job instead of letting the industry certify itself, like we saw previously, like we mentioned with the FAA and Boeing certifying itself, etc. We don't want these companies certifying themselves and testing themselves, because then it's rigged. Even when they're tested by the government, it's probably rigged. But when they're testing themselves, it's just a walk in the park.
And I'm not a big fan of big government. I think it has its limited role, but that's part of the limited actual role, is to do some oversight, right? And that's minimal, but actual some oversight.
Basically the only role. They should be the referees, not the players.
Right. And in the market decides, if you have all the information, so this thing may kill you, but it tastes great. Do you want to have some? I think that's an open thing. That's why cigarettes aren't banned. You can have a cigarette if you choose to. You can have 10, you can have 20. You can get a whole carton and smoke it till you pass out. It's all good. But ultimately, people should have the correct information. And just like the tobacco industry hid what it knew for decades, the same thing with the food industry and the same thing with the pharmaceutical industry. And to make your point even broader, it's not just that studies that where the hypothesis was disproven, but if you have a paper and it shows something that's novel or different, but it's not the narrative that the publication wants to have out there, they just won't accept your paper for publication. They don't have to apologize or give you a reason. They can choose not to publish. A lot of papers never make it into the journals where you expect to see these things. And then ultimately people believe, oh, because it's in fill in the blank, the Lancet or the JAMA or whatever publication, that, oh, that's the best of the science. And that may or may not be true. That's what this is intending to fix.
Many years ago, it used to be true.
Right. And that's what this is intending to fix, right? So that the goal is there are issues and there's no debate whatsoever, and anyone's being disingenuous or ill-informed if they think that all of this is so perfect and everyone's being given all the information they need to make the correct decisions. We just have to go back to the pandemic and see that people were stifled and not allowed even discussing other potential things, which now in large part have been shown to be accurate and would have been very helpful if we could have discussed these things. All that being said, there are changes coming, a lot of big changes.
Be sure to watch our other clips and shorts and the entire episode 14 of the Yojo Show podcast, and keep asking the right questions. Your health depends on it.